Welcome back. In any wilderness emergency, the most powerful tool you have is your mindset. Seriously, before you learn a single hands-on technique, you have to get the core principles down, the things that guide every single decision you make. And that's exactly what we're covering today, the mental framework for giving effective emergency care. So, let's dive right in.
Okay, I want you to really picture this. You're miles from anywhere, deep in the wild, and suddenly an emergency happens. Your first instinct might be panic, right? But panic isn't a plan. That very first thought you have, that first mental step you take, it is absolutely the most critical one. It really sets the stage for everything that comes next.
When you look at situations like this, you can see just how much things can vary. It could be anything from a simple twisted ankle to a full-blown evacuation. But you know what? The same core principles apply every single time. It's your calm, principled response that can take a totally chaotic moment and turn it into a situation you can actually manage.
So here's our game plan for this explainer. We're going to start with what to do when you're the first person on scene. Then we'll get into your core mission. We'll call it the 3 Ps. After that, and this is a big one, we'll talk about safety. From there, we'll navigate the legal side of things, and finally, we'll pull it all together to see how these principles really work out in the wild.
So what is your mission? Exactly. Before you even think about taking a step, you've got to know your goal. And in first aid, your job isn't to be a doctor. It's not to diagnose or cure. It's much simpler. It's to operate under 3 really simple but powerful principles.
And here they are, the 3 Ps. Preserve, prevent, and promote. First, you do whatever is necessary to preserve life. Keep the person alive. Second, you prevent things from getting any worse. Like stopping bleeding or keeping a broken limb still. And third, you promote their recovery. This can be as simple as making them comfortable and keeping them calm. Think of these 3 Ps as your North Star in any emergency.
And these 3 Ps are never more important than during what's known as the golden hour. Now, this isn't just some dramatic TV show term. It's real. It's that vital window, usually the first 60 minutes after an injury, where your actions can make a massive difference in the final outcome. Your job is to stabilize the patient during this crucial time. Okay, now for what is arguably the single most important rule. Before you even think about the patient, your absolute #1 priority is your own safety. I know it might sound a little selfish, but trust me, it's just pure logic. If you get hurt, you've just created 2 victims, and you've taken the only rescuer out of the equation. And protecting yourself starts with PPE, personal protective equipment. These are your non-negotiables. The bare minimum you need are surgical gloves. They create that critical barrier between you and any potential infections. A CPR mouthpiece is also essential, and if you have eyewear, even better. These simple little tools are your first line of defense. This brings us to a really important mindset called universal precautions. You have to operate as if all blood and all body fluids are potentially infectious. It's that simple. In an emergency, you're never going to know someone's full medical history, and you sure don't have time to ask. This isn't about being paranoid. It's about being a professional. Okay, so you've made the scene safe for yourself, and you've got your mission clear in your head. But there's one more piece to this whole foundation: the law. Understanding your legal and ethical role is every bit as important as knowing how to wrap a bandage.
Now this is where things get really interesting, especially for those of you who work as guides or operators. A lot of people have heard about Good Samaritan laws, but here's the crucial thing to understand. If you're in a professional host-client relationship, meaning they've paid you for a service, those Good Samaritan protections usually don't apply. You now have what's called a duty of care. You are legally obligated to help.
And a huge part of that duty involves getting consent. You can't just run up and start treating a conscious person. You have to ask their permission. This can be explicit, where they literally say, "Yes, please help," or it could be tacit, where they just nod or hold out their arm for you. Now, if they're unconscious, consent is implied. And if it's a child, you need indirect consent from a parent or guardian. Bottom line, if they're conscious, you always ask. And finally, let's talk about your scope of practice. Think of this as your professional boundary line. It means you only do what you've been trained and qualified to do, period. For example, you can't hand out medication, not even a simple painkiller for a headache. Doing that is illegal, and it's way outside your role as a first responder. You've got to know your limits and stay inside them. Okay, theory is great, but let's put this all together. How does this framework actually play out in the field when things get real? Let's walk through a quick scenario.
So imagine this. Your client slips on a wet rock and cries out in pain. Your training should just kick in, and this mental checklist starts running almost on autopilot. First, safety. Is this ledge stable? Are there any other hazards? You pull on your gloves before you even approach them. Second, your role. The thought isn't, oh, someone's hurt. It's, my client is hurt, and I have a duty of care. That immediately frames your response. Third, consent. You approach calmly and you ask, I can see you're hurt. May I help you? They nod. Now you're cleared to act. Fourth, the mission. Your brain immediately starts thinking in terms of the 3 Ps. Is their life in danger? No. Okay, how can I prevent this injury from getting worse? How do I promote their recovery by making them comfortable? And fifth, your scope. You know your job is to stabilize that injury, not to announce, oh, you fractured your tibia. You provide first aid, not a medical diagnosis. See how that works? It's a clear, logical flow from protecting yourself to taking professional action.
You know, following this framework is really the best way to avoid some of those common and honestly pretty dangerous mistakes that people tend to make when they're under pressure. Let's quickly break down a few critical errors you want to avoid at all costs. Every single one of these mistakes directly violates the principle we've just talked about. Thinking the Good Samaritan law covers you with a client? That ignores your duty of care. Rushing in without gloves? You've just violated safety first. Handing out a pill? That's way outside your scope of practice. And forgetting to ask for consent? That's a huge legal and ethical misstep. Avoiding these isn't just a good idea, it's your job.
Okay, let's bring this all home. I want you to think of this as the mental checklist that you should run through every single time. These are your absolute core takeaways.
Number 1. Your safety is non-negotiable. No gloves, no touch. 2. The 3 Ps are your mission. Preserve, prevent, promote. 3. As a professional, you have a legal duty of care. 4. Always get consent from a conscious patient. And 5. Know your limits. Stay in your lane and never act beyond your training. If you can burn these 5 points into your brain, you'll have a rock-solid foundation for any emergency.
All right, let's make sure all of this is locked in. I've got 3 quick questions for you just to make sure these key concepts have really stuck. Ready?
First question, which of these is not one of the 3 Ps of first aid? Is it A, preserve life, B, prevent worsening, C, provide diagnosis, or D, promote recovery? The correct answer is C, provide diagnosis. Remember, your job is to stabilize, not to figure out exactly what's wrong. That's for the doctors.
Okay, question 2. A guide's client gets hurt on a paid tour. Which legal principle is the main one that applies here? Is it A, Good Samaritan law, B, implied consent, C, universal precautions, or D, duty of care? The answer is D, duty of care. That professional relationship, that host-client dynamic, means you have a legal obligation to provide help.
And last one, how should you treat blood and bodily fluids at an emergency scene? Take a look at those options. The only right answer here is C. You have to always treat them as potentially infectious. That's the whole point of universal precautions, and it's what keeps you safe.
And there you have it. You now have the foundational mindset, the why behind every single action you're going to take. This framework of safety, mission, and legal awareness is what's going to allow you to act with confidence and do the right thing when it matters most. So the only question left is, are you ready to start building those hands-on skills right on top of this foundation? We'll see you in the next one.